Hi, my name is Dr. Tsang, and I am a neuro-optometric rehabilitation doctor here in Southern California. I had the pleasure of conducting the very first visual snow study with respect to the work that we do and saw the effects of change on patients who had visual snow. So just to recap, those of you in the know already experienced this, but visual snow is characterized by persistent dots in your vision. Some patients also describe the dots as being constant shimmery. Some patients describe color lights in their central vision. Sometimes the dots are black and white, but the persistence for longer than 3 months is one of the hallmark signs. Other symptoms that we have with visual snow are things like trailing in their vision, difficulty with dark at night, and also increased floaters, entoptic phenomenon, blue entoptic phenomenon also. So there's other visual symptoms that can also occur when patients have visual snow syndrome. One of the measures we look at, most of the time patients have been through lots of testing by the time they come to see me. And the good news is most of the testing is normal. The MRIs, the ERGs, the sometimes spinal tap, most of the testing is normal, and that's good news because now we know structurally everything is okay. What we look in the exam room here is we look at the functional aspects of vision and is there room for improvement. And one of the tests that we use is this instrument called the right eye. It's an eye tracking device, and it gives us an idea of how the eyes move. One of the measures is called fixation stability. Can the eye stay still? Another measure is called saccades or saccades. This is the eye's ability to jump either up and down or side to side. And then we have also smooth pursuit movements up and down in a circular pattern or side to side. And in these examples, they're normal. Tests are relatively normal in these cases. And I'm going to share with you some test cases some patients that I've had in the past. So this is a patient who had been diagnosed with visual snow after the birth of her third child. She had been diagnosed with H. pylori. She was having all sorts of gastrointestinal issues and then had been put on several different antibiotics and a proton pump inhibitor. And many months later, she just started developing the dots in her vision. And then it just suddenly, her symptoms really increased to a point where she could no longer take care of her kids. She could no longer work. She was in such bad condition that she couldn't really do any household chores. Her symptoms included the dots, as well as trailing images. When she looked at her husband and then looked at her child, the husband's head was on the child's head. So she was very uncomfortable in terms of all the visual phenomenon that she was seeing. She had intermittent double vision, she had blurry vision, she had headaches. She had a lot of things going on that prevented her from living the life that she wanted. So we worked together, and a few months later, we redid the testing, and this is the result. So it's clearly different, particularly in her left eye. And what was fun with this patient was when I showed her these results, she said to me, like, I just wish my eyes were like this. And I said to her that, yes, indeed, this is you. Your eyes really have changed. And she had started to notice symptoms had been reducing, and so we were seeing a reflection of eye motor changes and also a reflection of visual symptom change. So it was a lovely matching case. These are her vertical smooth pursuit movements. You can see her left eye and right eye were not behaving the same. Her left eye certainly was having more challenges than her right. This is the pre, and this is the post. Again, she was able to drive again. She was able to go back to work. She was able, more importantly, to take care of her 3 children. So when she first started coming, because she was having such visual issues, she couldn't drive. She was having her husband or one of her older children drive her from her house about 2.5 hours away. And by the end of our sessions together, she was driving herself, and she was doing just fine. These were her eyes with the smooth pursuit going across. So imagine she's trying to read or look at a computer screen. Visually, she was very distressed. And after the work we did, she was certainly better. Not perfect, but better enough that symptoms were greatly reduced. And she could work on a computer again. So good, so good. Okay, this is another patient. She also happened to be female, worked in a university setting, and she was at a point where her after images were so uncomfortable and her light sensitivity had gotten so bad that she was having a really hard time working. She has visual snow, and she had a pretty intermittent double vision as well. So blurry vision, double vision, and just really inconsistent vision. So this is some pre and some post work that we did. now her eyes were working much better together. Her symptoms had reduced. She could go back to work. One of the challenges of working in the university, they had all different colored light sources coming from different surfaces, and she had a really tough time. And after the work we did, she was fine to go back to work. These are her eye movement pursuit skills going across. So imagine again looking across at a computer screen from side to side was very tough for her. And this is after. So she's not perfect, but well enough that work was able to resume, and she was doing so much better than in the past. This is when she was looking eyes up and down. So you can see again, she definitely had issues when she went into down gaze. And this is the work we did. She was definitely much more stable, eyes moving up and down. So driving also became much easier for her. Life tasks became much easier for her. So common symptoms, again, as I mentioned, are persistent dots that last longer than 3 months, seeing after images or lingering sensation of the visuals that she just saw, swirling lights or clouds in vision that have increased even when eyes are closed, increased light sensitivity, very common, nyctalopia, which is difficulty seeing on low light levels, entoptic phenomenon, seeing images within the eye itself. Lots of patients complain of fatigue, headaches, and migraines. Some have balance issues. Many complain about tinnitus or ringing in the ears. And very common comorbidity is anxiety or depression and depersonalization. Here are some reviews we received from patients over the years. This particular person was a professor at a law university, and prior to doing the work with us, he was having a very tough time reading, working, just really having a tough time with his career. And after he worked with us, he was able to complete a major academic piece, very challenging. It required 10 to 12 hours of work a day, and he was able to get published in a very important legal journal that would change the face of law in this country. So he was kind enough to write me a note and share that the acknowledgments in the section of the journal that he wrote in included a lot of people who helped him on points of theory and law, everyone from famous scholars to White House advisors to federal judges. And he said there was one person who was more helpful than any of them, and that was me. So we're pleased to say that he's doing so well post-treatment. This particular person was a man from Norway who came. He had been to several times to the US for seeking care for his visual snow and did not find any answers. What was fun with him was when he first came, he was extremely light sensitive. One of his major symptoms, aside from the dots, was light sensitivity. And he could not go to the beach for more than 5 minutes here in Southern California because it was just too intense. And after about 2.5 months of working with us and work on his own, he was able to go to the beach all day long. In fact, he forgot his sunglasses and was still able to stay at the beach the entire day. So you'll see he wrote us a list of symptoms that he had post-treatment. He may have not shared half of these symptoms with me prior to treatment, but he had a lot of visual symptoms aside from the dots themselves. And he wrote down before treatment how the percentage were, and he wrote in terms of how much better they were after. So you can see, for example, things like the dots. Where was he? Let's talk light sensitivity. He had 30% light sensitivity, and now he was 85% better. He had dryness. His dryness was very bad, and it's now 97% better. He had lots of headaches, and they were 92% better. After images, 40% better. I'm trying to find the dots themselves. Floaters, dots, static, ability to read with more comfort, 20% better, peripheral vision more better to 100%. Again, very much better in many categories. What was interesting is many patients call and ask, can they make it 100% better? And my suggestion is you're going to find that you don't need 100% better to feel resolution. So this particular guy is doing so much better. He's able to go back to normal life. He was a ski instructor and a professional skier prior to his symptoms starting. And so one fun fact is he came in to see us after the treatment and had asked about balance, because what he noticed was his balance had gotten so much better during the course of treatment with us, so much so that his timing had been improving. While he was here, in order to keep up his physical therapy, he would go skating. He was on the ice skate. He was skating during the time, and his speed got so much better. And his mom, who happened to be here with him, mentioned that he looked like he was much better balanced. So the visual system affects many things. Aside from just the symptoms that you're experiencing, it does affect things like balance. We get great change. How I know over time he's done better is he called me a little while later during New Year's and said that he was now able to tolerate going to see fireworks. In the past, he had to stay in the room and had to shut himself out because the sounds and the lights were intolerable. And now he can go out and actually enjoy fireworks for real in person. So his recovery was lovely, and his life is back to mostly normal. This one's a long one. It's from Reddit. He's a gentleman I had seen many years ago with visual snow, and he had a lot of visual symptoms, but one of his biggest ones was tinnitus. He was very frustrated and angry, had some depression because of his symptoms. He had flown all over the place to try to get some treatment. So he came down to see me, and he also had a lot of changes in many, many areas. His double vision ghosting was better, his light sensitivity, the dots themselves were better. So I'm going to let you read this on your own, but there are many, many areas of symptoms that have improved over time during the work that we do. So I am hopeful that the experience will be the same for you. So these are just a few of the reviews that we received for patients on their journey with visual snow, and we really hope that we can help you on your journey also. Thanks.